Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls right here in the studio at 866-870-5752. That's 866-870-5752. And you might want to check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com.
Right, and the important thing about the website, beside teaching you how to avoid orthopedic surgery and heal up without it by using regenerative medicine of platelets and stem cells, is you can watch videos of me doing the procedures and see if it's something that you think is amenable to the way you like to heal. Obviously, to me, always in medicine, be conservative, and surgery is not conservative, it's invasive. And I have suffered from having it done to me. And Nita, you haven't had any surgeries, right, for orthopedics, thank goodness.
Not elective surgeries, no. I just had an emergency surgery after a car wreck, that's all.
That's a different story. That's important. But I love the surgeons, and they do the hardest work in medicine. I just don't like all these orthopedic surgeries that are done that, to me, don't need to be done. You know, we have differing opinions and ways of healing in medicine. And I argue with my orthopedic surgeon buddies, and I tell them what they do hurts people, and they tell me what I do doesn't help anyone.
Well, that's not true. You have tons of research.
No, it's not true.
Well, the most important thing for a listener to know right now is when you call the program today, you get Dr. Darrow's latest book for free, which is 5 years of research and 264 scientific articles. And the book is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate.
You know, and I didn't mention today that Suzanne Summers wrote the foreword to the book.
Yes.
And she also has a book that she wrote recently that has a chapter about my work in it. So at least there's 3 of us now that like what I do.
Oh, there's many, many more.
No, I've been doing this stuff 25 years, Nate. I get like 60 to 80 new patients a month. I think I've been told I'm the busiest regenerative medicine doctor on the planet. And everyone says, hey, you're 74, it's time to retire. And I go, what does retire mean? This is my hobby. This is not work. I love this. I absolutely love what I do. It's a lot of fun. It's amazing when people say, what do you do for a living? I say, I watch people heal.
That's true.
Yeah, it's amazing. We have a caller coming up here. I just want to say a few things before we get to you. One is we do something called the vampire facelift, which is injection of platelets and or stem cells in the face to regrow the collagen in the face. And it makes people, men and women, look better. And then we can also do it on the top of the head to stimulate the follicles to thicken up the hair again. It doesn't work on someone who doesn't have anything up there. But if you're just thinning, it works pretty darn good. So let's see what we got happening here.
Is that Keith?
Yeah, looks like Keith. It says a patient of mine. Keith, Dr. Marc Darrow. Which Keith are you?
Salmon like a fish.
Ah, I know you very well. You're a good buddy. Thank you so much for calling in. What's going on with you lately? I haven't seen you in a long time.
I'm doing pretty good. I'm actually going to head into a yoga class soon, which is partially thanks to you.
I like that.
Go and do yoga. Yeah. Yeah, thanks for being on the show live on New Year's Eve. That's awesome.
You know, I don't remember. It's been so long since I've seen you. What part of your body did I work on?
You worked on my knee.
Okay.
And actually both of them. And okay. It was quite a while ago.
Yeah, it's got to be what, 5-10 years, something like that.
Oh, I think it was 10. I think it's 10
years,
now.
Yeah. Yeah.
And it was one of those things where I think we were doing prolo back then, just regular prolo therapy.
Yeah.
And I had a few treatments, and I had a few of those things that you talked about the body as it works and how it relates to life in general, and basically tuned up my knee, and it felt better. But in reality, what I really got in tune with was how to make my body work better for me, and part of that was losing a lot of extra weight.
Oh my God, I forgot about that because you're a pretty thin guy now. But when I first met you, did we put you on a keto diet, ketogenic diet?
Yes,
Yeah.
I did the Ideal Protein for a long time, and that got me the pressure off of those things to give it a chance.
Right,
give my joints a chance.
So you're still holding up pretty good?
Oh, and that gave me the opportunity to go to yoga class. And
you were a great golfer, I remember too. Are you still playing golf?
Yeah, I play all. That's the one vice that I still have is playing golf.
Well, it might be a vice, but it's not a sin.
It's not. It's not a sin. That's right. But no, I enjoy it, and I'm able to walk a lot, and like I say, I caught myself. As you know, I do a lot of video work, and one time back in those days before I came to see you, I saw myself. I was shooting, but I wasn't supposed to be in the shot. But I saw myself walking across one of the shots, just setting something up, and I saw that I had a pretty pronounced limp that I didn't even know. I just started living with this chronic thing that I thought was going to be part of the rest of my life. And having come to see you, and like I say, I think you talk about this, that you were just talking about the images don't really tell you everything. And it's just the way the body moves, how you can feel the body, how and what you can do about it. What can you do? If I was going to get prolotherapy, I'd still be getting it if I hadn't lost the weight that I needed to lose, because it's just all that compounded pressure and gravity that just was, kind of screwing me up a little bit.
Well, I'm glad you've done so well. I just wanted to say a couple things while you're still there. We've morphed out of prolotherapy. I mean, we can still do it, but it's not as effective as using your platelets from your blood or your stem cells. And I know that because I injured my knee. I haven't told this story for a while on the radio. I had Dakota, my 85-pound husky, at the dog park, and he was just in heaven. He was running full speed, and huskies are very fast. And he came running at me. I didn't see him. And he hit his head on the outside of my left knee, and my knee buckled. And he hit me on the outside of the knee, but it hurt on the inside of the knee, which is a very dangerous injury called O'Donoghue's triad, where the meniscus tears, the medial collateral ligament tears, and the ACL tears. So I didn't tear those things terribly, but they got stretched out pretty bad. And I used prolotherapy because it's real easy. I just grab a bottle of dextrose mixed with lidocaine. I injected myself. I did it about a dozen times. And each time I would do it, I'd go out running, and it would come back. So I'd be okay. I'd feel better, but then I'd run, and it would loosen up again. My patella, the round bone of the front of the knee, was actually loose out of the groove, the trochlear groove in the femur. And so I finally had my staff draw my blood, and I did PRP on myself, platelet-rich plasma. And that one treatment tightened it up so I could sprint again. And then I did a few stem cells on it just to make sure that it was really healed very, very well. And I'm still running in the mountains with my husky. Dakota has become an old man. He's 91 now. He's 13, but in dog years, he's 91. So he's limping around, and he's not running anymore. But Bella, his younger co-conspirator, is running with me. And I'm not having any problems, so my knees are doing great. I'm glad you are too, Keith. And we'll have to get out and play some golf soon.
That would be great. I can't tell. I'd like to tell the audience just real quick that I don't know how many people over the years that I've recommended to give you a call.
That's right. And not only that, but I remember there was a caddy at Riviera Country Club where you play who was, I don't know how old he was. He looked really old and his knees were really arthritic. And you brought him in and you paid for his treatment. So you are a saint, Keith. Thank you so much.
He was a good guy. He's passed on now, but he thought he got the royal treatment day, and it meant a lot just for that he knew that somebody else was looking out for him.
Yeah,
and me and everybody else. And,
well, you're an amazing soul, Keith, and God bless you. I love you so much. Thank you for calling in and sharing your experience.
All right, I'm just going to give a quick shout out to my buddy Frank, and you know Frank.
Yeah.
He's hanging in there. He's been going through a few things, but he's hanging in there. I'm going to go see him right after class today. And
good. Well, I'll give him a call too.
Same family.
Yeah, I'll give him a call.
Yeah. All right.
Thank you for all the referrals. I appreciate it.
Well, it's just like anything. Some people make the call and some people don't. It's on their own time. They have to make the decision themselves.
Absolutely. All right, Keith. God bless you, and we'll talk to you soon.
Thank you, Keith.
Take care, Dr. Darrow.
Thank you. So if you want to talk to me live right now, like Keith just did, give me a call, 866-870-5752. I'm going to repeat it, so write it down, 866-870-5752. Also, you can talk to me at the office if you want to, or if I missed something on the radio show about what these procedures are to heal musculoskeletal pain. The number to my office is 800-300-9300. That's 800-300-9300. I didn't mention this before, but you can contact me through my website. There's a spot to email me on every page, and that website is www.lastemcells.com. I get emails around the clock from all over the world, and I answer every single one of them, day and night. I love communicating with people. I'm a people guy, and I like joking around with my patients. And Nita, I love stumping you on these jokes. And someday, I guess you'll probably get another joke answered.
You think so?
You might. You might get this one. You ready?
Okay.
What did the clock do when it was hungry?
It chimed.
It went back 4 seconds.
Ooh.
Do you get it?
Yeah, that's a good one.
Isn't
That's
it?
a really good one.
I like it. One more for you.
Okay.
Because people are not calling to get you off the hot seat.
Well, yeah. Please call and get me off the hot seat.
And you keep getting jokes until you laugh hard, then I let you off.
We should say the phone number. Why don't you say the phone number? Because maybe they forgot it.
All right, just to get Nita off the hot seat, it's 866-870-5752. Ready, Nita?
I think we should give the website also.
www.lastemcells.com. You're stalling.
I am.
What do you call
How about the office number?
800-300-9300. What do you call a can opener that doesn't work?
A deadbeat can opener.
Good. A can't opener.
Okay.
Why did the man get fired from his job at the calendar factory?
He ran out of time.
That's good. He took a couple of days off.
Oh, look, it's Julie in Culver City. Yay.
She just saved you. Thank you, Julie. Dr. Marc Darrow, you've got bulging discs. Neck or back?
My back, I have the number 5 bulging disc, and I was wondering if your procedure would help that. Because right now I've just been waking up in pain in the morning.
Okay. Do you have pain in the low back or down your legs or both?
Right now it's just going across right
above your buttocks, right?
My back above my buttocks, and before, because I had moved something and it was going down my leg, and it's finally that's that's
That's
gone away
gone.
because I had a lot of numbness and tingling going all the
Okay.
way down my leg. But
So the good news is you had a little bit of what's called sciatica. 94% of those go away by themselves without ever
Yeah.
mentioning them to a doctor. So that's good. And what you have is really what we call an enthesopathy. The enthesis is where ligaments, tendons, and muscles attach to bone in the pelvis there. And it's very, very easy to heal. I treat those every day of the week, sometimes many a day, and there's nothing to be concerned about. As we age, we get bulging discs. They do not cause back pain or neck pain. So don't let some doctor tell you that you need a surgery because you have bulging discs.
mm-hmm.
All right? You don't have much going on there. It's very simple. And I have to touch the area to make sure what I'm telling you is correct. But from what
Okay.
you're telling me, you basically have a sprained ligament in your low back. And unfortunately, a lot of people get an MRI and it shows something like a herniated disc. They get surgery and it makes them worse because it wasn't the problem to begin with. So be careful.
Okay. And then last night, I don't know why, but my left leg just started hurting, and I haven't been picking up anything.
Okay.
I guess it's the groin area that what you were talking about.
Yeah, you'd have a groin pull. The adductor muscle may have been sprained a little bit.
Yeah, but I don't
Julie,
know
how
I
old-
would've
how old are you,
sprained it 'cause
Julie,
I
if I
haven't
might
done
ask?
anything.
How old are you?
I'm 80. Oh, how old am I? 70, 75, 76.
Okay. Well, you said I haven't done anything. Living is doing something. You know what I mean?
I
This-
haven't pulled anything or picked anything up or.
Right, but you did probably pull something without noticing it. And
Okay.
I get people every day who come in and they go, I don't know what happened. I just woke up and blah, blah, blah. It's
Yeah.
very common. The human body is a machine, just like mechanical machines, and it wears down, it gets older. And as much as we're all into, health and anti-aging and all that stuff, we're all going to the same place, which I hope is heaven, right? And on the
Right.
way, there's physical things that break down, and even without us knowing that we did anything to cause it, they happen. It could be just be walking down a stair and catching ourselves or something like that. And a lot of people that I see really don't know what caused their pain. They don't have an incident. It could just be wear and tear, overuse syndrome. It certainly could be an accident of some kind. It could be arthritis. But most of the stuff we can heal using regenerative medicine of platelets from the blood and stem cells. So
Okay, so you use my own stem cells,
we can use your own stem cells, your own platelets.
my own blood. Okay.
Yeah, we can do it any way you want to do it. There's a lot of, what do they say? There's a lot of ways to skin the cat, and I do a
Okay,
lot of
so
them.
all I have to do is just call your office and then make an appointment.
Yeah.
Have it checked out then.
Yeah, I'll be able to tell you in about 10 seconds if I can help you, and I don't need an image to do it. If you have an image, I'm happy to look at it.
Yeah, I do. I have X-rays and I think I have the MRI.
Okay. You got to be
I've had
careful
it
of
for
those things
years
because
because I've been
they
fortunate
often
to
lead to
accident.
surgery when you don't need it, because the surgeons
I'm
are looking for a reason, and the reason they find is in an image, and the image doesn't usually have the answer.
I have another question. I have a granddaughter that has cerebral palsy, but it's not. It's a touch of it, and it affects her what do you call it? Her neural system, and she walks and everything, but she walks. Her right leg is the one that's the weakest,
Okay.
and I don't know if you could do something to strengthen that leg, or because she walks with her knees like almost touching each other.
Yeah, that's
And
probably
then
more in the
right leg
neurological
can't-
area than the musculoskeletal area for what I do. So I'd be
Yeah.
happy to see her, because if is she having any pain, or it's a
No, she's never complained.
Okay.
She's 18 now,
yeah. If she doesn't have any pain with that, I probably cannot help her.
and but she's supposed to do exercises, and she really doesn't. And
Well-
I think now that she's older, she's
Yeah.
thinking of having a surgery, and I don't want her to have surgery.
Well, surgery may be the best thing for that, because sometimes there's muscle contractures that can be released, and then she can walk better.
Okay. Well, maybe I'll take her in, and then you could just check her out.
I'd be happy to see her, yeah. God bless her. And God bless you, Julie. I really appreciate you calling in.
Okay, thank you, and bless you. Both
Thank
bless
you
both
so
of
much.
you, and have a happy New Year.
Thank you so
Julie.
much.
You as well.
Thank you. Bye.
Bye.
What a sweetheart, huh?
Yeah, she sounds so young. Not
She
that
is
75 is old, but I mean, she sounds like 30.
Well, she went from 86 to 75, so she's probably only 40. Right?
Okay, sounds good. And our phone number right here in the studio
Is 866-870-5752. We still got a couple minutes left for a caller or two. And if you want to get a hold of me or talk to someone at the office, the number at the office is 800-300-9300. And the website where you can email me, every page has a spot to email me, and you can watch the videos of me doing procedures there, see if it's something you want to do, is www.lastemcells.com. So, Anita, we have a couple minutes left, so I may as well...
Take a question?
I'm going to take one joke first, because I love jokes.
Okay.
Nita, why did the golfer wear 2 pairs of pants?
Because it rained, and he had to take off one pair of pants so he could wear his dry pants to finish the game.
Whoa, that's very, very cognitive. Why did the golfer wear 2 pairs of pants? Because he always gets a hole in one.
Oh, okay. I can live with that. Oh,
I've actually had 2 holes in one. What do they call hole in ones in my life, and I'm not a good golfer. Even bad golfers can have a hole in one.
Well,
Suzette,
some people
pop that name up here so I can talk to this person.
Yeah, she's working on it. I can see her.
You can see her.
I can see her. Yeah, she's in a different studio today. So, I was going to say that a lot of golfers say, oh, they've been playing for years and they're not very good, but they keep playing. So what's that about? You can answer that later. Let's talk to Russ.
Russ has a bicep issue, right, Russ?
Good morning.
Hey, Dr. Marc Darrow, how are you?
I have a detached bicep in my right arm.
Okay.
And I went to a surgeon, and it appeared to me he didn't want to do anything because I didn't have the vaccine. Do you have any recommendations?
Wow.
That's crazy, right?
Yeah, that's kind of strange.
Can you bend your arm? Is it totally detached, or is it just a little tear?
Well, no, the bicep detached. Of course, the other half of it is still on, but it's a problem.
So the part of the biceps tendon near your shoulder is okay? It's intact? It's just in the forearm?
It came off the shoulder.
Oh, it came off the shoulder. Okay. So let me tell you a little bit about that. In most cases, that's not a big deal. And what you lose generally is about 15% strength of the biceps. It's just one attachment.
Yeah, you'd think so. But when the doctor heard that I didn't want to take the vaccine, he was like snarky almost.
Well, he didn't let me finish.
Oh, excuse me. I'm so sorry.
No problem. So those usually are not repaired because it's more cosmetic than anything else. Where, you know what? Go to the website and I'll get back to you. The website is www.lastemcells.com. Email me there, and I'll get right back to you, and I'll give you a call, okay? And I'll tell you more about it. God bless you, everybody. Thank you, Suzette. Thank you, Nita.
Thank you,
If you want to
Dr.
reach me
Darrow.
at the office, the number is 800-300-9300. And Russ, I have a lot of good information for you. Get a hold of me.
Okay, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.